morning, everyone. Today, I want to talk about a topic that could reshape the future of mental health treatment, the medical use of psychedelic drugs. Drugs like MDMA and psilocybin are currently illegal, but scientific research is revealing their enormous potential to treat conditions like PTSD, depression, and anxiety. Conditions that traditional therapies often fail to address. Despite these promising results, there remains strong opposition to legalizing psychedelics for medical use. My goal today is to explain why psychedelic drugs should be legalized for therapeutic purposes and why the opposition's concerns, though valid, should not block access to these life-saving treatments. So, let's start by understanding why so many researchers and clinicians are advocating for medical use of psychedelics. David Nichols, a pharmacologist, argues that psychedelics, when administered in controlled clinical environments, offer unique therapeutic potential. In his 2016 article published in Pharmacology and Therapeutics, Nichols explains that psychedelics like psilocybin can promote neuroplasticity, essentially allowing the brain to reset and form a new, healthier pattern of thinking. This has shown to be particularly effective in treating depression, where patients often feel trapped in cycles of negative thoughts. MDMA, another psychedelic drug, has also been shown to help patients suffering from post-traumatic stress disorder or PTSD. In 2017, a study by Michael Mithoefer and his colleagues, published in the Journal of Psychopharmacology, reviewed clinical trials in which MDMA-assisted psychotherapy was used to treat patients with severe PTSD. The results were striking. Patients who underwent MDMA-assisted therapy saw dramatic reductions in PTSD symptoms, with many maintaining these improvements long after the treatment ended. This offers a potential breakthrough for veterans, first responders, and others who have experienced any types of trauma. However, not everyone agrees that these substances should be legalized, even for medical purposes. Some experts argue that the risks associated with psychedelic drugs are far too great. According to Richard Smith in his 2020 article published in the American Journal of Psychiatry, there are several reasons for concern. First, while psychedelics may have therapeutic benefits, their long-term safety is not fully understood. Psychedelics can trigger intense emotions and psychological experiences, and some patients may not be equipped to handle these effects. Smith also highlights the potential for misuse, especially if the drugs become more widely available, even under medical supervision. He points out that there is still a lack of regulatory frameworks to control their distribution safely. These concerns are important to address, but they do not outweigh the potential benefits for patients in controlled environments. While risks are inherent in any medical treatment, they can be minimized through careful regulation and oversight, much like how opioid painkillers or other controlled substances are managed in medical contexts. Psychedelics, when used responsibly, under the supervision of medical professionals, have the potential to be just as safe, if not safer, than many existing psychiatric drugs. So why, despite the risks, should we move towards legalizing psychedelic drugs for medical use? First, let's consider the alternatives. Patients with treatment-resistant depression or PTSD face very limited options. For many, antidepressants, talk therapy, and other conventional treatments simply just don't work. Psychedelic-assisted therapy offers a new pathway for these patients. It's not about replacing traditional therapies, it's about providing a new additional tool when other treatments have failed. Furthermore, we already have examples of how previously controversial substances have been integrated successfully into medical practice. Medical marijuana, for instance, faces similar opposition but is now legal in many states and has provided relief for patients with chronic pain, epilepsy, and other similar conditions. Psychedelic drugs could follow a similar path. By legalizing them under strict medical supervision, we can ensure that they are used safely and responsibly while also expanding treatment options for those who need them most. In fact, Nichols, in his 2016 article, emphasizes that the therapeutic use of psychedelics is fundamentally different from recreational use and medical settings. Doses are carefully controlled and patients are closely monitored by therapists. This reduces the risk of abuse or adverse psychological effects. Moreover, clinical trials have shown that patients who undergo psychedelic assisted therapy often report feeling a sense of profound emotional healing, suggesting that these treatments offer benefits that extend beyond the scope of traditional mental health therapies. In conclusion, the time has come to rethink our approach to psychedelic drugs. While opponents raise legitimate concerns about safety and misuse, these risks can be managed through proper regulation and clinical oversight. The evidence is clear. Psychedelics offer an enormous potential to treat mental health disorders that have been resistant to conventional therapies. By legalizing these substances for medical use, we can provide patients with new options for healing and improve the quality of life for millions of people who suffer from conditions like PTSD and depression. Let's not allow outdated stigmas to stand in the way of progress. Psychedelic-assisted therapy represents the next frontier in mental health care, and it's time we embrace it. Thank you.